Did that.
Yeah, something. But I've got the charger, I'm just plugging it up. But this is charged right up.
Yeah.
Turned on the blades, they spun. All the mice went flying.
I'm not as good as I used to be, but I used to on the off seasons for my snow thrower and my mower. I used to start once a month.
The recording is on, it said.
Run a little gas through the line.
Greg said no, approved, stop going. Call for
Still got it.
site
Yeah, the
plan.
one thing I read,
Yeah.
and now they do it. They recommend not getting 87 octane, but 89
Okay.
for lawnmowers.
Gavel's
Really?
close as you
Yeah, I don't know whether they're just in cahoots with the gas company.
Problem.
Grabbing for power, Mike.
I tried to give it to Shay, I forgot I was the chair last meeting.
Okay, we'll call this meeting of Seneca County Commissioners to order. Please join me in the pledge. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Please join me in one moment of prayer. Heavenly Father, we ask for your guidance as we make decisions that benefit the people of Seneca County. We ask in a very special way that you look over all those men and women who are protecting our freedoms and their families. We ask this through your Son. Amen. Okay, so I'll accept the motion to approve the digital audio. I guess we gotta go roll call first. Let's try that.
Commissioner Kirschner?
Here.
Commissioner Thomas?
Here.
Commissioner Stacy?
Here,
Okay, now I'll accept the motion to approve the digital audio video recording of the previous board session held January 23rd.
So moved.
second,
Okay, roll call on that, please.
Commissioner Stacy?
yes,
Commissioner Thomas?
Yes.
Commissioner Kirschner?
Okay. Any new adjustments, any kind of adjustments to the agenda?
I've got just a couple of little things I want to update on. So
Okay.
just a little list of things.
All right, why don't you start with that?
Okay, one of the things we have is the health department, the OEPA, have sent around some questions on some failing septic systems in Seneca County, and there's some meetings going to be held, and I just wanted to make you guys aware that for no other reason than I was available, that I signed up to participate in these meetings, so
Okay.
you might hear some more on that. I'm not sure that the commissioners ourselves have any direct responsibility for this, but it's one of those things that doesn't fall anywhere, so I think it falls here.
Okay.
and they have Mark engaged as well as the sanitary engineer for the county.
Yeah, they're trying to get everybody together, so, Mark in the health department, and township, and city and county. So it'll be a multi-jurisdictional type of conversation. The other thing is, I sit on the chamber board, and the Visitors Bureau kind of reports to the Chambers Board, but I haven't really reported anything back here to us as a full board. And I wondered if we should invite the Visitors Bureau in to give us a report at some point in the future, if you guys have any objection to that. We kind of approve that tax, but contract with, I guess, the chamber, I guess that's the right word. So I feel like we should, as a fiduciary duty, have some report back on that. You guys have any thoughts on that?
I think it's a great idea, yeah.
Yeah, and I know they have in the past, I just don't know if it's been annually or however, but I think that's good.
Okay.
It seems like it's been a while.
I attended the meeting yesterday for CHIP, and several partners in our CHIP program are Fostoria, City of Tiffin, Seneca County. Fostoria last biennium, 2 year, was the lead on the program, and WSOS wants to do the program again, and it's just a matter of deciding on who would be the lead for the partnership. I don't have any strong opinions about it, but since it's a multi-jurisdictional kind of thing, I thought it made sense that regional planning do it, but Fostoria has expressed an interest in continuing to do it, so there'll be a little bit of a conversation there. I don't know if anybody has any strong opinions about that one or the other.
Do they have a deadline of when that everything has to be in place, or?
They're supposed to be emailing us a timeline.
So they know they'll do the big assessment type meeting with all the
Right.
partners and stakeholders.
And there's some
so
new
forth at some point.
requirements, and so.
I just think it's a little way for us to give a little bit more support to Fostoria. We can, so that would be my thought.
Yeah, I don't have a strong opinion on
We'll
the
see
chamber.
we'll see where the chips fall.
Made a little presentation over in Attica the other day about using the land bank for clearing the old Eagles property. So they've been very patient. We've been working hard on that, and so we should be going out to bid in the next week to 10 days, and we'll know where that final number is. We do have some funding lined up from private sources and other sources to handle that, assuming that the bid comes back at something reasonable.
Yeah, we've got a land bank meeting today, so you're welcome to sit down if you want. I'm not sure if they have any update about, about Attica or not, but I'm sure there'll be some
We have meetings at
conversation.
1:30.
Yeah.
Yeah.
And then the last thing I have is, I don't know if you guys remember, there was a big settlement with VW was altering their diesel emissions
Yeah.
reports.
Yeah.
And so there was this global settlement across all the United States. Each state got a certain pot of money. And Ohio, I think, got 75 million, and it's supposed to be for pollution reduction programs. Well, as we speak, OEPA is proposing a program that specifically excludes rural counties, saying, well, we're going to put all of our money into Cincinnati, Cleveland, and Columbus because these are our pollution corridors. And it's in an open comment period now. So I just wanted to let you know that I was going to comment to the OEPA that, we would like to have some of that money as well. So, and not to specifically exclude us. I mean, I don't mind if they wanted to put a competitive funding cycle together for rural counties, and we weren't successful, but the fact that we are precluded from applying for those
Yeah.
funds
Get an option.
is really a disservice to rural America. Yes, sir.
Is it only air pollution?
Yeah,
Oh, never mind.
yeah.
What else did you have in mind?
The algae stuff.
Yeah?
The
Yeah, they
runoff.
like to blame us when, you
Yeah, well,
know,
I mean, actually, that's
it
a
don't
good
help.
point.
Yeah.
Don't help
That's a
us.
good point. I mean, such things as ditch clogging too. I mean, part of that is part of littering, which is part of pollution, blah, blah, blah. So there could probably be a number of twists to that thing. Maybe we ought to do a formal resolution and file an objection.
Okay.
Go through Representative Reineke.
I've notified his office that
Okay.
we were, and sent them all the information. And I've talked to the OEPA and expressed my displeasure, but I would like to.
Yeah, I appreciate you working on it, but it may be a little more powerful if it comes from the Board of Commissioners.
Absolutely.
Because we are all of the same mind here.
Okay, I'll prepare something next week. I appreciate it. That's it, thank you.
You bet. Justice Center.
Justice
Commissioner
Center.
Stacy.
We had a good meeting on Thursday, very productive meeting in terms of, lots of input from all of the stakeholders of the building and on various things. So key word at the top of this says tentative, but I just typed up the dates that were talked about because we went round and round for a while. I'm hoping we're all literally on the same, here's one for Stacy, we can share it. However, but what we said at that meeting after, like I said, going around and around on some of these, but I think one of the key things that Commissioner Thomas brought up, which was a great idea, and I appreciate the judges liking this idea too, is that open house pre-move-in of court documents and those kinds of things as an opportunity for folks to see truly all of the courthouse. Whereas when we get to the point of a grand opening and people are in there, there's gonna be areas that we can't take the general public through, without that being either impossible or very difficult or, a lot of special arrangements. So the tentative, and then with that thought also was the lighting, that we don't want it to sit forever and wait for the fun lighting stuff that has been tested and is looking fabulous to happen. So we thought maybe the night before. So Friday, March 9th being the date that the lighting ceremony, after it's dark, at some point to do something there. Saturday, March 10th, an open house, possibly 10 to 2. Again, this is all tentative. And then the moves start the week of March 12th. So March 12th, 19th, 26th, and then to April 2nd, get one floor at a time moved in, have a formal ribbon cutting and the time capsule ceremony at some date in May to be figured out. But that's the target month. And then we assume fall will be opportunity for ribbon cutting for juvenile probate court upon the completion of the annex stuff. But again, that's just definitely a date out there because we haven't even gotten the bids and all that stuff yet. So just wanted to share that. Other than that, things were going well. Things as things are getting completed and keep coming down off the floors and accumulating into the main lobby area there, and all of that kind of stuff. They are on schedule, and this works with their schedule and so forth. So cupola stuff today. Cranes being set up as we speak. The target is going to be for that first lift of the lower portion to go up today. It has to go up. The markings made, it comes back down. They do some drilling and then put it back up and secure it. And then the second portion, the clock tower and the dome portion tomorrow, and potentially Lady of Justice. Mother Nature must not want that to happen. The forecast doesn't look like that will happen if the weather goes as predicted because of the wind.
35 mile an hour.
Yeah, I'm thinking that's probably,
And
we don't want it to end up in the auditor's office or on top of the,
we don't want a skirt blowing out.
So, the anticipation is it might be 2 days anyway for those two parts, the top and the dome and Lady Justice, because it will be a separate lift. So, it might be by the end of the week. We'll just play it by ear. We do have the live cam is operating, and people can watch that and stay in where it's warm and watch things occurring during this time, and that's at Seneca-county.com, our webpage. Right at the top, there's wording. It says to the Justice Center live cam. So encourage folks to check that out. Come down, watch it, whatever. But yeah, it's weather dependent at this point.
Okay, safety grants.
A reminder that the next Justice Center meeting will be March 1st at noon instead of the fourth Thursday. We changed it from February 22nd to March 1st at noon. Just
Did you want to
add that?
Yeah, I did. Okay.
Just so
You
you
have
know.
that?
Yeah.
Yeah.
No, that's been changed and
And on the Justice Center, our landscape committee has finalized the sidewalk program. And we don't have to decide on this today, since this is the first you guys are really seeing it, but I wanted to get it to you. We met yesterday, and so essentially, there's 3 main components to this. The big wishbone in the front would be new sidewalk. It's blue, maybe you can't quite see it, it's blue. That would be the new, which would give a egress across the front of the lawn and the egress from Washington Street to the main entrance.
a little pointer thing.
Oh, wow, look at that. How does it work?
They always laugh when I bring that one. Look at that, how much easier is that?
Yeah. So when the judge goes to Reno's, he can come down this sidewalk up here. So we have a cost estimate of that on that of $24,726. This concrete out here needs to be leveled, which John has a quote for leveling that. And that would be like hydraulic jacking underneath it to get it leveled back up. The concrete itself is in good shape, but it all needs leveled so the water flows in the right direction and that it's not a trip hazard. The concrete around Gibby is really bad, so that all needs to be replaced. The only other parts of this that before I talk about Court Street, is this sidewalk comes out that goes to the current entrance. So there'll be a break in the sidewalk from here. There'll be a landing out this door for emergency. The Leadership Seneca County Bike Rack will go there. And this sidewalk comes out except for a landing because everyone will have to, per the security committee, everybody's coming through the security gate, so these doors will be emergency exit only, and we don't want anybody to be confused and think that they're entrances. Of course, unless you're coming in the back door, then you got other
So,
problems.
are we leaving the current brickwork in place off of Market Street?
This is going to be, yep,
Okay, that
That-
stays in place. So we're not using any of that down further west?
correct.
Okay.
This is all done
All
at
right.
this point, so it looks nice. It also fit
Yes.
ties well. This will be just kind of a little courtyard sitting alcove. The benches will still be there, the bike rack will be there. I think it'll continue to look nice. In here.
Well, we talked about even where the old entrance was, you know, for the employees, maybe putting a couple of benches or a couple picnic tables in there, 'cause that's kind of a protected from the wind kind of an area.
I think the concern is that we don't want to encourage the use of these doors except for an emergency.
I get that.
Yeah.
Okay.
And then the master gardeners would have a spot here where they're going to do some landscaping. And then that's as far as we've gotten at this point. You know, once everything, the grass is up, the sidewalks are in, and spring comes, we may evaluate additional ways that we need to spruce it up, but this is kind of the bare bones. So that's the first 35,000 of this. The second part of the conversation is Court Street here. One of the recommendations is that this sidewalk be widened so that it's a normal sized sidewalk. It's, you know, that tiny sidewalk now, and that the retaining wall be moved. That'll allow us to clean it better, allow people to walk down there. There is some parking along there, so when they get out and go across, it'll be available. So the committee is recommending that we do that next step, which is the 27,000. My question for us is, you know, in the MOU, and I know it's been expressed in here and by the judges as well, that, you know, that some enhancements be done to Court Street. You know, I don't know if we want to hold that on anticipation of trying to get a more comprehensive solution for Court Street as far as streetscaping and sidewalks and pedestrian ways, or if we want to do this intermediate step of widening the sidewalk and doing the retaining walls. You know, I mean, it is expensive at $27,000. Or the alternative is just put everything back the way it is, and it's the narrow sidewalk, and the retaining wall stays where it's at, and it would virtually cost us nothing, because whatever damage has been done by the contractors needs to be put back.
So it's costing us the additional money to widen the sidewalk?
And move the retaining wall back.
Okay.
So,
That's the
so you would
27.
look to a credit, or maybe you said that, then it's that too, from, they need to get it back to the condition it was in.
Right.
And they'll do that. But if we were going to do more,
Yeah.
it would be almost silly to do that. Yeah, it's hard to digest the total figure here.
Yeah, no, I want you to
Knowing
look
that
at
doesn't
it.
get us plants and other things for, once that
Well-
part's done. But, so I'm wondering if that is the initial thought is maybe that is definitely a wait. It'd be nice, but, you know, we can't do everything always, so.
Yeah, no, and that's why I wanted to put it up, give you guys some time
Well,
to think about it and look at
right.
it.
Do we get some specific credit from the contractor?
We don't know the dollar amount yet,
Okay,
but
but
we
we will get-
will get something.
So the figure you're talking about, 22,000, 27,000 is that probably gonna be net?
That-
Is that what you're
That's the
estimating?
gross number, so there'll be,
Okay, so there'll be some, okay.
there'll be some credit back on that.
Yeah, okay. I didn't know that, so that's good. Is there anything that same way up on the west part of the west?
I don't
side?
think so.
There's nothing that has to be restored there?
Not that I'm aware of.
Okay.
Not that I'm aware of. So that's where the conversation's at this point, and I talked to the city about whether or not they have specific plans for Court Street, and they don't at this point. You know, funding concerns. I'm going to meet with the downtown committee on Thursday to see, because the master plan for downtown does have Court Street streetscaped, and the MOU that we have with the city does have Court Street streetscaped. A couple of different plans there, so I just hate to miss the opportunity and spend the money if it's going to be redone in the future or whatever. So, if you guys take a look at Court Street, those sidewalks, and kind of determine how
Yes.
I wondered, were you talking about widening the street the whole length of Court Street, or just to have it stop there at the new addition?
Stopping there at the Sally Port, because once you get to the Sally Port on back, there's really nothing on that side.
Nothing, you mean,
Well, the sidewalk is there, but that sidewalk's a regular
That's,
sidewalk.
this, yeah, but it's.
I'm sorry.
Yeah,
There's no
you're
more
right.
buildings or anything, is what, yeah.
Yeah, basically servicing this parking and getting a sidewalk so we can keep it clean. Then the sidewalks, there's a break here basically where the Sally Port is, and then this sidewalk is
Regular
adult
size, what I
size.
would call regular.
Adult size.
This is fun sized over here. But, yeah, guys take a look at that and we can talk about it next week. Anything else you'd like to add, Your Honor?
Just one thing, by Gibson, those steps are coming, isn't there a step or something? I don't have my pointer with me. New concrete. Well, you guys back there can. This is gonna be kind of torn out, new concrete or something, getting rid of the step?
Yeah, we're gonna level out what I call Speaker's Corner there, where everybody gathers for protests and public
Freedom of speech.
freedom of
Yeah.
speech.
Events.
corner.
First Amendment is what we do.
First Amendment corner.
Thank you, Judge.
Yeah, and legal speech. Speaker's Corners, yeah, we're going to level out that concrete and make that, because it's uneven and there's some steps there and whatnot.
Any other questions?
And there can't be a lot of activity on the courthouse lawn because we have that stormwater retention basin underneath the sidewalk. We can put a sidewalk over a portion of it, but with all the utilities and everything that's in there, there can't be a lot of tree planting. No more ice skating rink. I mean, there's some things that have changed because of the systems that are in that front yard now. So just for the benefit of everybody, there's not a lot of opportunities to landscape much further, actually, as far as trees and bushes and that kind of stuff, because we have to keep.
Shane, I got a question for you. So 20 years from now,
Yeah.
is there a plan somewhere that the county has that will indicate that stuff like that can't be placed there? Is there somewhere? I'm just
Well,
the
saying,
drawings.
any-
because I don't think, 20 years from now,
Yeah, well, the good news
Some of
is
us may not be here.
anytime there's a need or somebody wants to use the any county property, they have to make application specifically for whatever that activity is. So hopefully, they'll know. 10 or
Add it
20
to the
years.
list.
Stacy and Nick will
That's all
still
I'm
be
asking.
here.
Yeah. They'll be, at her retirement party, she'll let the next person know, yeah.
We have a book of secrets that we pass on.
yeah, with all the infrastructure that's put in there, I'm just,
Yeah, it's all mapped out. John has all that mapped out.
You can actually see, it's the box with the wishbone. That box right in there, all that length in there. And I don't know how much dirt there is above it. I don't know that, but certainly can't plant a tree over something like that. But
I'm just thinking the next set of commissioners,
Good point.
Stacy probably retired by then.
Well, nice job, your committee's working hard, Shane.
Yeah.
there was free fudge yesterday, if anybody
Yeah.
showed up.
It's a true story.
Okay. All right, in respect for Subcoast time, let's get them up and going. You had, what, I heard you had a 5-minute presentation, is that right?
Well, we're gonna
He's
cut it.
telling you,
We're
he's
gonna-
telling right now.
We're gonna cut it down. How short do you want me to make it?
3 minutes.
Thank you very much for your time. We greatly appreciate your consideration. With me, my name is Melissa Bodie. I'm from the County Commissioners Association of Ohio, SEDCO program, County Employee Benefit Consortium of Ohio. And as you know, every 3 years, we go out and shop our business, shop for our vendors. Every year since we've been in business, Anthem has won that business for our medical piece. And we just wanted to take a few moments to tell you why they continue to win this business. So without further ado, Cindy McCarty, is going to share some information with you.
Not that fast.
Uh,
I didn't get a warning, so I'm gonna use my time just getting ready.
Okay, well, that was your warning. We did stop this morning and we had coffee at Bailiwick's.
Yeah.
Bailiwick's, that was
Bailiwick's.
very, Bailiwick's.
Very
That
nice.
was very good.
So I'll let you handle it, if you don't mind. Well, you can do that, and then.
Yeah.
Well, the sub wears off.
Or you want to trade me seats?
Sure, let's do that.
And so we stopped at Bailiwick's and I sat in one of their chairs, their kind of wicker chairs. And I guess it's all over the back of my dress because I get that kind of stuff. So don't look, okay?
When they notice, I'm gonna do it.
We outlawed mistletoe for crying out loud.
Okay. So Cindy, if you want
We're supposed to fold this up and put it in our
go
wallet?
right ahead.
When we're done,
Just kind of
yes.
follow
It's
along.
multi-use. Or you can take the
Take it
set
home and
home
frame
and
it,
use it
Shane.
for dinner tonight and be able to wipe it clean.
That's a nice place, man, too.
So we went to that because instead of handing out a big presentation with a bunch of pages, we found this allows us to lay it out in a way that's hopefully easy for you to read and gives you a good overview. But as Melissa said, I'm Cindy McCarty. I am an account manager at Anthem. And I've actually been there almost as long as Subco has been in existence, so I have worked really hand in hand with Melissa and the Subco team for quite some time. But I really do appreciate the opportunity to come and meet with you. And our goal was, again, to go back, and even though you have been in the program for a while, we know that some of the things that are kind of the mainstay and the focus maybe need to be reiterated or reminded, because our goal is to continue to educate members, help them to be better consumers, and maybe think about some things that might help them in that way. So we're starting out on the side with the flag, the state of Ohio. And what we've highlighted here are the big picture value of working with a large carrier like Anthem. We know that having that presence is very important, but we also know that when it comes back to Ohio and working with the counties, that we need to have that local presence as well. So you probably are aware that we have been operating in Ohio for over 75 years, and we do have a home base and a president right here in the state. So decisions are made locally with, again, a much better knowledge and understanding of the environment and what we're dealing with here in the state, both metropolitan and rural. So we know that's very important. And when I look at the highlights and the size of the company, we know that how it really impacts your county and your members is most important to you. So 99.5% of the claims that come through today are in network. So literally a very small portion are out of network, which is better for your members. So they're not having to take responsibility for submitting a claim, making sure that any prior authorizations are done. Even just using the system in the best way it can be means that, you know, they're working with network providers, so they're credentialed and meet that criteria for quality. And with that, the discount, which is kind of the baseline for everything we do on top of that, at this time is 51.8%. And I don't get to sit down with a lot of counties who get those kind of numbers. That's definitely the high end. Some are in the high 30s, a lot are in the mid 40s, but when you look at the hospitals that your group is using or are using at 51.8% discount. So, and please stop me if you have questions, because I will go quickly, but I also want to make sure I keep it relevant to you. So on the right side, we highlighted a few of the programs. So today, educating people is a real challenge. Trying to be a good healthcare consumer is, in a lot of ways, a new concept. Many people don't really understand that they have choices, that they have information available, that they can be very aware of where they go for care, who they're talking to, and with that, Anthem's goal is to control cost of care. Everything we do is in place because it's going to help your member to be able to make good choices, educated decisions, and have the support they need, and help the county and Subco to continue to control costs as much as we possibly can. But as you know, it takes a village. So we talk about complex care, really very few people, like 0.1% of your members drive high claims. And you see it every year. There's only a few people who really have high claims, and A lot of the counties don't even see what we would consider to be the really high claims, the $1 million and above. But they do come up, unfortunately, from time to time. So we have nurses who work with people who are maybe struggling with the system, navigating it because they have to see a number of different providers. Unfortunately, people who are really very ill oftentimes do have more than one condition they're dealing with, and with that multiple people they maybe are seeing. So a nurse who can help them navigate the system, be aware of the community services that might be available, that's what a complex care nurse is going to do. And they're going to work with someone who maybe has MS, multiple sclerosis, or rheumatoid arthritis would just be two examples of the kinds of things they focus on. Then future moms, right now it's not unusual, but a lot of the counties, and yours is one of them, you don't necessarily have a lot of people in childbearing years. Looking at the information, there were only 5 people in the hospital this year for a birth. So future moms probably isn't a big deal or a big focus, but if you have that person who is pregnant and they are high risk especially, the best thing that can happen is for them to have a good outcome and them to have resources they can talk to and work with. That's what Future Moms is all about. I know through the years Melissa has probably given you flyers and posters and different things you can share to make sure people who do get pregnant have that available and know they can call in to enroll. But we want to remind you about that program. The one that you do unfortunately have more people involved with is condition care, otherwise known as disease management. So the people who have that chronic condition of asthma, diabetes, heart disease, heart failure, or COPD. And today you have 63 members who have been identified. Many of them are high risk or moderate, which means they have these conditions and they have not found a way to manage it effectively. So again, they have a resource available to them. It's about 12.6% of your population, which is quite normal. But the reality is we want them to know they have resources. We want them to take advantage of those programs. We want them to work with their primary care physician, which we'll talk about a little bit later. And we know if they refer them to the program, we have a better chance of them doing it. But today, where we make outgoing calls to these people, many go unanswered. Many of them, we don't even have a good phone number because so many people have dropped their landline and only have a cell phone. So we really look to your involvement and the team you have to be able to communicate this and help people understand why they might want to try it. It's free. They don't have to commit, but if they do take advantage, they might find it really works well because we get great results and survey feedback. The cancer care program is a separate program, and I only want to mention it because what you don't hear about very much, and you may or may not be aware of because you have a lot of things on your plate, obviously, are the programs that are happening behind the scenes. So anytime we can identify an area that we might be able to really work effectively, in this case with oncology providers, we are going to do that. So there are programs that have existed for over 5 years where we offer them assistance and direction with proven, evidence-based ways that they can recommend to treat their patients. You may or may not be aware, but no two cancers are alike. The information coming at an oncologist is tremendous. Their ability to keep up with it can be challenging. So they appreciate the support that we provide. Believe it or not, there's a partnership and we work together. And the goal is that they make a lot of money. The revenue stream into those practices comes from oftentimes the medications, the chemotherapy meds they choose to use. If they go with a pathway that is evidence-based, and it's the one that Anthem has recommended through this program, they get dollars from us. So we offset that, and we looked at that, we established this program, we worked with oncologists, and again, it's viewed in a positive way. This is all behind the scenes, you don't need to worry about it, your members aren't involved with it, it's all happening with us, working with the physicians. But when you're asking yourself, like, what is happening, what's really out there today, what is Anthem doing, is that the best solution? Should we be looking at other options? You know, these are the kinds of things that you want to be aware of and at least be able to ask questions about and be able to know that, wherever you may be looking, do they offer the same kind of programs and do the same amount behind the scenes to really help us help our members? And that's really our ultimate goal in conjunction with SEBCO, of course. The integrated imaging, a little different. This one we do outreach. So MRI is very expensive. And then also CT scans, very expensive screenings. Not everybody knows they have alternatives. Not everybody knows that just because the doctor says to go here, they don't have to. You can be using the tools available to you. You go out and look at the Anthem.com estimate your cost tool, and you can find that you could get an MRI. And I looked at one example This is an MRI for a neck and spine. And I used, of course, Tiffin as the center point to do this. And the range for this same MRI can be as low as $366, or it can go up to over $2,600. So some of you probably are like, yep, I do that. I've gone out, I've looked at that, I'm well aware. There are freestanding facilities. Some of them are up in Toledo. There is one in Findlay. Blanchard Valley Hospital even is more affordable. It's $660, so not quite as low as PDI Toledo or Imaging Central. But people are oftentimes willing to drive, and you have an HSA plan, so people might even be more open to it because they have out-of-pocket expense, and if they are going to be spending the dollars, they probably want to make sure they do it in a way that makes sense for them. So this information is just something to highlight the fact that you have choices. If you choose to go to a hospital like Mercy St. Vincent, which is one your employees or their families use a lot, it's $1,400 for that exact same screening. Mercy Tiffin is $2,300. So if you had more time in another day, we could talk about pricing and how hospital costs can often be higher than a freestanding facility. In the end, you need to do what's right for you and go to the place that you feel is going to be best. But again, knowing you have choices and knowing there's ways for you to be aware of the options you have goes back to that consumer and trying to, again, help people really help themselves.
And here in Seneca County, we have with the HSA and a very kind of a high deductible PPO plan, our members are much more responsible than you would have in a county that maybe has a $350 deductible, where the member's only going to pay $350 up to their max out of pocket. Here we have much more, I hate to say more responsible utilization, but that's exactly what it is. And that's what happens when members have more responsibility to pay. So this is one of the programs that have really surprised a lot of people when we talk about it. They'll get a call from an Anthem rep that says, you have an MRI scheduled. Can I help you reschedule? Can I help you move it because it's going to cost you this much at this place and it's going to cost you $300 at this place, which is going to be a big deal. There has to be a huge cost for Anthem to get involved. Well, what's that? What's the cost differential?
$300.
$300. There'll be a $300 difference in cost, and the member does not have to do it. It's really just to let the member know that they have options. The funny thing is if they're buying a television, they're going to do their homework. If they're getting an MRI, maybe, and that's because when a doctor tells you to go do something, that's what you do. But we just want you to stop, question a little bit, is there a least expensive place? And we just give that information to our members. Sorry, didn't mean to add time to it.
Yeah,
But I can't
thanks,
sit quiet for
Melissa.
too long. Okay.
All right, so on the back side, here's where we talk about what Anthem has invested in the last 5 years. It's called Enhanced Personal Health Care. It's a value-based contract that we've established with primary care physicians because we know that primary care physicians are the most affordable. We also know that they are the best quarterback. So the goal is for everyone to have a primary care physician, and ideally it to be one of the ones that is participating in this program. And again, using Tiffin as the base, I did look up within 25 miles there are 30 of these physicians. Within 50 miles, there are 294 of them. It's over 55% of the physicians, primary care physicians in Ohio, that have recontracted. So today, instead of delivering what we would consider to be a volume-based care, which is they see you because you had something happen, an episode, maybe you're diabetic and you didn't feel that great, you went in, they addressed the issue, they sent you on your way, they saw you again the next time you had maybe some episode occur. Now, and the little cartoon on the top of this gives you an idea of the old or current approach versus the new, which is the enhanced personal health care. Those physicians, they're working with our provider team. We are out there at least quarterly, but often it's monthly. We give them reports and information so they know the patients they have, they know the risk profile, and they also know if you've been in the emergency room, if you were admitted to the hospital, and all these things that you would think they would be aware of, but because people are not really necessarily recognizing their primary care physician as the quarterback, they may or may not know. One thing I know I'm seeing across the board is a lot of people go to a specialist. That's all they go to. They do not go to a primary care physician. So maybe if they have a heart condition, they're getting that taken care of, but that means that's all they're taking care of. They're not even looking at, again, the holistic approach and the fact that there's more to us than just that. And the fact is that you need to be taking care of everything, not just the one issue, and only a primary care physician is going to do that. They're the only one who will do a full exam, who will really talk to you and help you as extensively and completely. And again, do it much more affordably. And if you have a relationship, they're easy to get in, easier to see. So the goal, again, and Sebco has been doing this relentlessly, is really making sure, if nothing else, people have identified and are seeing a primary care physician. And in the middle section, we already know there is savings tied to this program. Sebco in total has over 9,000 members who are seeing physicians in this program. So over $1 million has been saved in each of the last several years. Within the county, I estimate you have maybe about 61 members attributed, so it's a smaller number, maybe about $10,000. But again, $10,000 is $10,000. You can do a lot of landscaping and different things, obviously, with the dollars.
It's a lot of cement.
And that's the goal that you would have. So the thing that we want to highlight as well is at the bottom, what we're really trying to do is help people so that they're not being admitted to the hospital, they're not having outpatient services that maybe aren't necessary. And again, the inpatient surgical services are going down because the primary care physician is going to be a little bit more focused on maybe trying physical therapy and doing other things that we know can work, as opposed to jumping to the most extreme option that might work, but also might not. And we all know with surgery, there's more risk involved. So if you're going to take that step, again, be educated, know that you've tried other things, know that that's the only option, know that your doctor and you have worked together to reach, whatever end result you may be targeting. And again, here in this county, it is absolutely true that you have more people going to a specialist and using a specialist as maybe their PCP instead of having a relationship with the PCP. And it's much more expensive to go to a specialist. So when you take all that into account, if we did nothing else this year but try to educate people on that, it would ultimately pay off long term and help people to be healthier, which is, again, always that balance.
And our goal to get you there is with our wellness program. They have a very great, they have great participation. And part of the wellness program is to send results to a primary care doc. You get points if you do that. So we'll, we're kind of working that in there.
So the example would be maybe a cardiologist or something like that as opposed to primary? What would be the specialist?
That's an example of one for sure. Cardiologist, dermatologist, urologist. There's any number depending on the kinds of conditions, even an endocrinologist, because if someone is diabetic, they probably have an endocrinologist they're seeing. But again, their goal and their focus is specifically diabetes, but as you know, that is often combined with other comorbidities, and ideally the primary care physician can manage a lot of that, where you'd only maybe need to go to endocrinologist once in a while because the primary care physician is really managing it and paying attention to kind of the whole body, not just that condition. And it's not to take away from anybody, because when it gets to a certain point, that might be the right doctor to go to, but you really want your primary care physician to refer you there and recommend that that's what needs to happen, because they are no longer able to maybe work with you with whatever it is that's happening, as opposed to you deciding, oh, I'm just going to go there, which is unfortunately what people do today. And it may not be necessary, and it may cost you more, and it may not give you the same result as if you had just worked consistently with that primary care physician.
Like, for
Does that make
instance,
sense?
I was recently diagnosed with breast cancer, had my surgery, all of that. So I have a cancer doc. And so I go see my cancer doc. But I have to see my primary care as well, because although my cancer doc thinks I'm just, a miracle, my primary care doc not so much, because she's watching everything else, all, liver enzymes. She's watching all of these other things that isn't really, so even though we go to the one specialist who is very important to make sure that, like a cardiologist or anything like that, they're very important, but you have to have that primary care doc watching over everything else. And that's what their job is. And the EPHC takes that just a little bit further. And that's where we want to make sure everybody is making sure they're getting all their preventive exams. And your specialist is just making sure they see you. Your primary care is making sure you've done your colonoscopy, make sure you've had your annual exam, make sure you've done all of those things that you need to have done.
But statistically, you think we're higher than
Oh,
the
yes.
rest of the?
I will tell you
Subco
exactly.
overall, but first let me
what,
just point out,
or-
Subco overall is as well. So you're
Yes.
right here with,
So
so
Subco.
you're not alone. Subco overall, our people see specialists and not primary care docs as much.
More
because
than the
people don't-
Anthem.
Right, so
Yes.
so this report is last December through November, 12 months of data, which is really what you need to look at to have, what's viewed as being statistically sound. So I will give you the exact number. So we look at annual visits per thousand, and for a primary care visit, Seneca County is 35% below our book of business. When I look at a specialist, same exact thing, annual visits per thousand, you are 26% above. And I believe I just
what
looked at
those
this
Subco
yesterday for Subco, and the above number was 42%, so overall it's high. The below number I think was 25%. So, and again, it's just supporting the point that people are probably relying more on their specialists because we went away from what the gatekeeper concept years ago. But now maybe we've gone too far, as normally happens, and we need to try to pull back a little bit to get people to really recognize the value and importance of a quarterback, a primary care physician.
Is there any due diligence done on if there's enough primary care physicians in the community?
Yeah, that's the number you said before, didn't you?
Well, those were the EPHC. Now, primary care docs, when I ran it in, so primary care docs versus EPHC, you have a lot more primary care than you do the enhanced personal health care providers, but there are ample providers, and I have that, if you want to know exactly how many, and
Well,
I
you
did
can get
it
to me
within
later.
a third.
I just
Okay,
wonder
Actually, I ran the report.
if that number is being driven by not having enough
availability.
primary care physicians in the community. Because I've heard people say, I can't get into another doc. And I don't know, Ron, if you are all over the community.
No, I think that you got a good point. The question is, do we have enough PCP here, or are the people just getting into whoever they can get into?
Right.
So here's what we have found happens, because people will say they can't get in, but the reason that we have heard, because we do dig into it, because we're like, what do you mean? Like, we're being told by this practice that they absolutely are accepting new patients. But if your first call to get in is when you're sick, it's not probably going to be easy to get in, because they're going to absolutely take the appointments for the patients who have a relationship with them. So you really need to call, and it's going to probably take a little while to have a first appointment scheduled, because oftentimes even when you call, if I'm going in just for my physical exam, it's out maybe a month or two before I could get in for it. But the reality is, if the call is at the time when you are just seeking to talk to and establish a relationship with a doctor, then you're probably going to hear more positive answers. If the call is because I'm sick and I want to come in, it's very hard and not really likely they're going to schedule you for a sick visit as your first appointment with that doctor. So that's a factor that we hear about. But again, no, we do agree there was a concern about a shortage when ACA first came about. It's still probably a possibility, because we know there aren't as many people going into the primary care practice. But at this point, we are not aware of any area where we have physician practices that are identified in our system as accepting new patients who are telling people that they are not. And it is noted in the system and can be even used as a criteria when they look for them as a practice who is accepting new patients. So if you find you hear otherwise, we definitely would do follow up on our back end.
It's difficult to find a new doc, so primary care. So
Yeah.
the fact that you may want us to work on reducing our costs and educating people, I want to make sure that we have the resources in place to do that. I don't,
Well, I don't disagree, and I wish I had a perfect answer for you, but the reality is if you have somebody who does come back to you and tells you exactly, or gives us, Melissa, even the detail of who they were trying to reach out to that said they didn't accept new patients, we would definitely do the follow-up on our end if our system indicates otherwise.
Which we have
Because it is
done.
very important to us to make sure people have access. But another county did make that point, and when it came down to it, it was more, again, the scenario I described. The practice absolutely was accepting new patients, but because they couldn't get in the minute they wanted to when they weren't feeling good, they came back and said they're not accepting new patients. So we have to work through it. You're right, we will get bumps. Anything new and different, it's not always going to be easy. But again, the goal is raising awareness and hoping that some people who haven't would take that step. So, but we will work with you if you run into any roadblocks.
As well as Julie and Ryan.
Oh yeah, absolutely.
Absolutely. Okay.
So on the right side,
Anything more on that?
okay, we have the information on estimate your cost, or what we're noting here as the care and cost finder. And I'm sure your group is already very familiar with this because, again, with the high deductible health plan, people are more likely to take the time to look at the over 400 elective procedures that are out there and look at where they might be able to go to have these types of things done, and maybe with that make a choice, you know, to go to one that's more affordable, to go to one that's more expensive, but know going in probably what the likely cost is, the cost is going to be. One of the things that this can be done for is something like a knee or hip replacement, which, you know, at this point there obviously are the Blue Distinction Centers of Excellence that could be used. The way the plan is set up now, you know, your members will have a lower cost share if they do elect to use one of those facilities. But this is where they can find information on what the facilities are and if those are ones that they would consider going to for a knee and hip replacement, maybe spine surgery, even some heart procedures. And again, there's over 400 procedures because most of what we do is elective. It's not as much emergency as you think. You hear about that, but you know, there are a lot of things people elect to do that, you know, gives them time and the opportunity to make a decision, and that's what the Care and Cost Finder can help them with. Any questions on that? And then
Last but not least.
the Live Health Online, you're probably all familiar with, and maybe you've registered for Live Health Online. It's an app you can get to on your phone. This is actually being able to see a physician, again, 24/7. These are licensed physicians practicing here in the U.S., but they're available to you or a family member. And not only is this access secure, so Shane, this is one of the things that we established when we felt there might be an issue with people being able to get in, because we thought there'd be a huge population shift and more people needing physicians. That didn't necessarily happen the way we thought it would, but the reality is this program has served us very well and is supported by the physicians, because they either, you know, if their office hours have been extended, there still are things that can happen in the middle of the night or early in the day. Maybe you have a child who has an ear infection. You've been through it many times. You don't need to go to your doctor. You can just have that child in your lap, do this call with your, you know, computer, with your smartphone, with your tablet, and that way be able to have that visit and get it done, not having had to go to an emergency room, not having had to go to urgent care, and ideally being able to pick up the prescription when that pharmacy opens in the morning if the ultimate need is for some kind of antibiotic or something like that. So sinus infections, upper respiratory infections, there's a whole number of things that they can see you for that people are like, what? How do they do that? But they do. They will ask you, you know, to do different things that help them to be able to confirm a diagnosis, and that way you've gotten your visit done, didn't have to go to that doctor's office, or worse yet, an emergency room. And the cost of these visits is $49. So when you look at cost of care and you think about $49, there's not any other thing we can do. Nothing is going to be as affordable as that option. It's not replacing your doctor. It's just, again, giving you access when you know you need it, and avoiding an unnecessary trip to the emergency room. And unfortunately, when I looked at your own history and information, you have people who have gone to the emergency room for sore throats, and then migraines. And the reason I'll tell you why migraines is not a good thing is the first one you have, you may not know it's happening, so you might need that kind of care. But once you are a migraine sufferer, you need to be seeing your doctor, because they are the ones who are going to be effective in helping you figure out what kinds of things you need to manage that. And going to the emergency room every time you have one is taking care of it just at that moment. But even when you leave the ER, they tell you, make sure you follow up with your doctor. And if you're not doing that, you know, they're going to be back in the ER every time they have one. And depending on how frequently, which can be a lot, it's a lot. And it's not convenient. So ideally, we want people to have the alternative and be comfortable knowing that they can go somewhere besides the emergency room for care. And as you know, as of January, for your PPO plan, those are now covered with no cost share. So That's just something for, you know, your members should know that, but that's something just to keep in mind.
And it's only $49 for the HSA members.
Right.
And that's because we cannot give it away, because they have the tax break. By being in the HSA, we're not allowed to,
Only
do it at no
preventive
cost
care
share.
can be covered at no cost share on the HSA plan by law, so that's why that's a little different.
so
do
that
you
was
have
a
any
lot of
questions?
information
It was.
that we just gave to you.
Okay, any other questions, Commissioner?
Thank you.
Thank you very much.
Thank you for letting us come. Carrie,
Yes,
you have a
Rob.
question?
I have a question, Cindy. In that comparison on the MRIs, where does ProMedica Foster Community Hospital fall in that?
ProMedica, no, of course they're in here.
And just to make sure we're talking about, these are not like emergency situations. Emergency situations are done and taken care of right then. This is things that you can schedule. You have 2 weeks to get this done. Your doctor sends you with a prescription, and then you can make choices. So,
ProMedica's not on the list, where's the other one?
That's it, ProMedica Foster Community Hospital.
Oh.
Maybe they're not in network with you or something.
well,
They are.
they are.
No, what happens is this is self-reported information, and for this particular kind of MRI, they just may not be one of the facilities, for whatever reason that isn't on here, or I'm missing it, which is
Thank you.
probably a possibility.
Thank you very much.
Is it Astoria Community Hospital, or is that a different?
Yeah, but it's owned by ProMedica.
Okay, it's $1,600. $1,695 is what shows here. Astoria Community Hospital,
Okay, thank you very much.
which is, yeah.
Any other questions? Thank you very much for your time. We really appreciate it. Great to see you.
We always bring you up here when the weather's great, don't we?
Well, you know what?
It was
It was
fine.
great. It was
Last
great.
year was fall.
Well, remember the fog? It was
Yeah.
terrible. And so this year we had lots of time. We gave it plenty of time, went over, had coffee.
There you go.
Although you definitely got more snow up here than we did.
Yeah, you got a lot.
It looks much prettier.
Yeah.
On the side of the
roads
road.
here,
Huh?
just pretty into the brown.
You got the safety grant information? Okay, so let's get the safety grant. Yep.
Okay, safety grant. I think I sent each of you a copy of the grant agreement a couple weeks ago. I asked Kathy Moore to come up in case you had any questions. The last financial report, which we have just a few changes, but basically they've narrowed it down to the 33 Panasonic tough books. We have some notebooks on there, a server, some licensing, ProPhoenix servers, some video conferencing, TVs, different things, for totaling of the $163,000 that we got for the safety grant program grant. They're using the purchase of the generator that we did for the Justice Center
Okay, yeah.
as a match. NCOESE is using part of the loan as a match, which it will be no cost to the county, but they're going to use that as a match as well. The partners that were included in this that will benefit is, the Village of Attica, Village of Bettsville, Bloomville, Green Springs, New Regal, Republic, and the City of Tiffin. Total project costs are estimated about $326,000. So that's where they come up with 163. Kathy's in the middle of getting just a very few last minute updated quotes, because obviously when we ran these, they were over 30 days old, and we need to have updated quotes. So I just wanted Kathy to come in case you had any questions, any comments. I don't have any money in place for this yet, but all of the paperwork will come through the county. John DeVoli is listed as the project manager, but all the bills will come through the county, so.
So this safety grant, how much more is available after this for other things?
None. As you probably remember, we asked for 500,000. We were awarded 163,000.
That was because of what we did with the ambulances?
Yes,
Yeah,
that's
okay.
correct.
And as far as we know, they're not doing this program.
They are
again.
not. Matter of
Okay.
fact, the loan was closed out December 31st. When this is done, these funds will no longer be available. We were, by having to get the re-quotes, there were some good things that happened, and one of those that we got an additional 3 tough books from the vendor for those, for less money actually than what we originally quoted, so that's a positive. And we had found out one thing that we needed for the safety project and the Pro Phoenix was a cooling system in the facility at Tiffin's, at the city of Tiffin, so we were able to use the funds for that as well. And as Stacy said, there's a few things we just need to, very minor adjustments we need to make in some of these quotes, but we are very close to spending the 163.
Okay, will you take any action today?
I'll get, if it's okay with you, I'll get the resolution accepting the grant and then get the amount ready to put in place. I'll just do it for next week. If you didn't have any questions or anything else you want me to get.
I just remember the sheriff's concern was about so that his existing mounting brackets was gonna be, did he get that answer?
Yes, he
Okay,
did.
good.
Yeah.
That was a concern for him.
The grant agreement does need to get to Columbus, be signed to get to Columbus.
Yeah.
That's a priority.
Yeah.
We're replacing some tough books, right? Are those, is it replacements?
Yeah.
Yep, of
So
all
will
the
the other ones
sheriffs.
go out of service, or will they be made available?
The old ones,
Yeah, do we know?
That will be up to the sheriff's
Yeah.
department to do whatever they want with those.
if they wanna sell those on Gov Deals or, I actually hadn't talked to the sheriff about that, what do you do with the old ones?
And how much was the generator?
130,000?
We basically came up with that project because it was very close to the match.
Yeah. And so then you guys are spending another 36,000, is that?
We made the rest of the match happen, yes, through our funds.
And you put that, and that's going in the city building, is that?
Yes.
Cool.
Okay,
I'll make a motion that we accept it, or do you want?
Do you wanna do the grant so I can get that on?
sure.
So that she
Okay.
can get her paperwork.
I have a motion
Is
for
that-
us. A second?
Second,
Okay.
and then I have a question and discussion. So I just thought of this. So there is some monies that we will pay. Does that come out of the money available for the thing, or is that additional?
The county will not have any more funds.
Okay.
Okay, so we have a motion and a second, roll call please.
Commissioner Stacy?
Yes.
Commissioner Thomas?
Yes.
Commissioner Kirschner?
Yes. Okay, let's move on to appropriation adjustments and
We
supplemental
have our
appropriations.
11 o'clock, 11 o'clock
Need an
executive session.
executive session now?
At 11.
Okay, I will accept the motion to go move to executive session.
I will make a motion that we go into executive session to discuss pending litigation.
All right,
I'll second.
okay. Roll call that.
Commissioner Stacy?
Yes.
Commissioner Thomas?
Yes.
Commissioner Kirschner?
Yes. Okay. So, we'll come back and do appropriations, right?